Hi everyone, Sari here, one of your clinical prosthetists and manager of technical support and global clinical communications with Freedom Innovations. Today's webinar is going to be a replay of COVID-19 industry updates with Ashlie White and Justin Beland from AOPA. Please note that this webinar first aired on April 23rd, 2020, so there may be some updates and changes to the information provided as this is a fluid situation. For CEUs, please complete the quiz that will be linked at the end of this video, and you must pass with over an 80%. For additional free online CEU courses that are available whenever you are, please visit freedom-innovations.com/PNO data and sign up there. Thank you again for your interest in our webinar.
Hello, everyone. Good morning, good afternoon, and actually good evening. We have some international participants. So wherever you are in the world, welcome. Give everybody another 30 seconds or so. I see some people still logging in. We'll wait another 30 seconds, and then we will get started here. We have quite a bit to cover. I feel like one of those, it's like on, you go on Instagram or some of these other social media sites, you watch people logging in as the numbers continue to go up here. So, all right, so I think we're ready to get started here. So first of all, again, welcome to Freedom Hour. My name is Eric Ferris, Head of Marketing here at Freedom Innovations. On behalf of the company, I hope all of you obviously are staying safe, practicing our social distancing and all that, and to get us through to definitely better days, which are ahead of us. One thing that I always like to reiterate, and it's something that's very important to all of us at Freedom, and that's that we are here to support you, right? In whatever way, in whatever capacity that is needed. I think one of our field team members says, you know, she really strives to be an extension of your practice, and we hope that we've really kind of engendered your trust in order to get to that level. And so when you look at our company, right, we are all positioned to support you throughout this kind of period of disruption. Our entire sales force, all of them, remain out there selling, obviously respectfully, respecting CDC guidelines and everything else, but every rep is still out there in the field, either selling, helping tech support. They're there also if you'd like to just, you know, complain about Tom Brady and the Bucks, whatever it is you would like to discuss, be sure to reach out to our reps. Our customer service team remains the same in terms of their hours, right? 9 a.m. Eastern to 7 p.m. Eastern. Our help desk, same hours. It remains open, 9 a.m. Eastern to 7 p.m. Eastern. And our clinical services team remains ready to answer your questions, same amount of time, right? 9 a.m. Eastern to 7 p.m. Eastern. So whenever I talk to customers direct, I always like to say, however crazy you think the question is, just ask us, right? And let's at least have that discussion relative to your issue, and let's see if we can support you in some way. So one of the issues that came out of these discussions around support was the idea of kind of access to information that was not necessarily product related. And so topics such as business issues, marketing plans, social media strategies, cash flow analysis, right? There's a bunch of stuff that's not product related. And so we took that idea and said, okay, that's something that is needed, and it's something that you guys have requested. And we also kept in mind the fact that there are 1,000 webinars out there, right? One of my local coffee shops here in California is literally doing a webinar this afternoon at 3 o'clock about how to brew a good cup of coffee. So that's kind of where we are right now. If you got some information, get on a webinar and go for it. So we've kept those two things in mind, right? And what the Freedom Hour represents, hopefully, is information that's absolutely relevant to you, essential information to you during this time of disruption, but it's also presented in a very efficient way. Because again, we know there's 1,000 WebExes out there. We know there's 1,000 different points of information. We want to distill it down into the most essential information needed for all of you when managing through this period of disruption. So with that in mind, we now have courses scheduled through June 18th. So if you go to our website under events, you'll see all of them listed out, and there's a whole host of topics there. So I'd encourage all of you to kind of take that visit, if you will, and to see if any of those topics are of interest, definitely please sign up, and we'll be seeing you every Thursday, as I like to say, at 11 a.m. Pacific, 2 p.m. Eastern. So we want to start this kind of transition into non-product information with a high-level perspective. And so I don't think there's anyone better to do that than Ashlie White and Justin Beland, both from AOPA. And what they're going to be talking about are three kind of fundamental things relative to managing through the COVID-19 disruption. And the first thing is really what you should know as we work through the next probably 6 months or so, right? And there's a lot. I think Justin and Ashlie, they just updated the presentation like 45 minutes ago. Information is constantly changing. So what are the things that you really need to know as clinicians and as clinic owners? Second thing is, the second topic is, what should you be doing right now? There are certain things in terms of applications and funding and programs that, hey, you may want to be taking advantage of right now. And so they'll cover that. And the third topic will be things that you should really be preparing for. There's a lot of activity going on in Washington right now, a lot of things happening, a lot of things changing. What things are on the horizon that, hey, we think you ought to be aware of? So those are the three topics. And so with that, I'll turn it over to Ashlie and Justin to take it from here. Thank you, guys.
Justin, you want to? Yeah.
Well, I greatly appreciate everybody taking the time today and look forward to a good conversation. If anybody has any questions at all, of course, there's a question box on your webinar. Definitely send in those questions and they'll be relayed to us and we can answer as many as we are capable of answering, which hopefully will be quite a few. And I'm going to have, Ashlie is running the slides, so I'm going to ask her to advance the slides.
So Justin is our Director of Government Affairs, as you can see, and I'm the Director of Strategic Alliances. No, it's okay. The American Orthotic and Prosthetic Association, AOPA, which some of you may be employees at member facilities, is a membership organization of over 2,000 patient care facilities and over 150 manufacturer, research, educational, institutional members. So that's the makeup of AOPA as an organization. We are a trade organization. We do a lot of lobbying on the Hill, but we also oversee a research funding pillar as well as educational pillar. So those are the things that make up AOPA as a membership organization. And we're going to start right off with a poll question. Justin, go for it.
Yeah, so we were just curious, and I'll bring this poll up on the screen a second. Yeah, these are the questions that you're going to see, but I'm a little curious as to what describes the current state of your business. So you've got a couple of answers there. I'll just put this up and folks can answer it now. Hopefully everybody can see this. Can folks see this?
Yeah, we can
Good.
see it. Thanks, Justin.
Excellent, good. The answers are coming in. I'm going to leave this up for 30, 45 seconds or so, and it looks like we've got a pretty even distribution so far, with the exception of not a lot of folks seem to have closed, which is good news. So it's another 10 seconds or so for folks to get in their answers. It looks like most of them are locked in. So I'll put this up on the screen. Share, there we go. So, and I'm sorry, that's the first poll I've ever done on one of these webinars, so I'm very excited about how that went. So thank you for being a part of it. So it looks like we've got pretty even distribution between folks who are open and have some impact and then operating at limited capacity, but very few folks are closed, which does not at all surprise me. And I'll switch back out of that. We have heard from many of our members, most of our members really across the board are doing everything they can to stay open because as we'll talk about when we get into what we've been doing with Congress during this pandemic, we need to be open. You need to be open. Our patients are relying on this work being done. So thank you for being open and thank you for the work that you're doing. Greatly appreciate it. So first we're going to, as you heard in the structure of this, we're going to go into some things that have been going on. Things that you should be aware of in terms of what Congress has been doing and what AOPA has been doing. So I will let Ashlie start with some of the things on our website and our co-op.
Yeah, so we wanted to point you to some response and resources related to the COVID-19 crisis. This is a screenshot of AOPA's website. I'm actually going to take you there live now. So if you're on the AOPA website here, there are a couple of places you can find information. Under resources, the very first link is the COVID-19 Response and Resource Center. This will take you to a page with a lot of information about the COVID-19 responses. This includes information that we're going to discuss today from CMS, HHS, Congress, how the CARES Act applies to you, all of the different analysis that we've done, as well as guidance that we've put out since the beginning of this crisis. This is the link to get you to the co-op, and I'm going to show you some information about the AOPA co-op as well that's relevant for any resources you're looking for COVID-19. The AOPA co-op is it's a compendium of all things O&P. It's a collaborative effort. Membership sends in concepts, issues, thoughts, things that they've seen in policy. They pose those questions to us at AOPA. We review them. We vet any of the information that's provided, and we put it back on to the co-op. And so the co-op, if you go to the co-op, this is the AOPA co-op if you've never been there before, and you'll see there's lots of information that's shared for COVID-19 response. We have a section called the member-to-member section, and this is actually resources that O&P organizations have provided for AOPA to share. So these are internal documents in some cases, internal documents that have been shared with staff or internal memos about how to operate, and also external communication. So you can see some different information here that might help you as you're navigating through some of this. And we'll continue to add resources as people start to navigate, reopening of economies around the country. Obviously, places are going to be doing that at different times, and so we'll be adding additional resources as our members send them in to us. The member-to-member section generally is a place for our members to put resources that are free to the whole O&P profession. So you'll find that those are the resources that are listed there, but we do have this whole section dedicated to COVID-19. We also have the State Matters section, and in the State Matters section, under each state, we acknowledge the current stay-at-home order. We have that linked. We also have AOPA's guidance on COVID-19 state and local restrictions, and where people have sent us local relief resources, so business grants or funds that are available for your businesses in your area, we've added those when our members send those to us. So those are some kind of additions to the co-op. We also, under each section, where relevant, we have guidance around, like if it's Medicare policy, you're going to see a lot of COVID-19 updates on the Medicare page right now. So we're tracking all of this information and updating it regularly. These are chronological, so the most recent announcement is always going to be at the top of the page. So that's just a little background information for you all to know. And also, we have done we've had a lot of conversations and done a lot of digging, and we have not found a single place where orthotic and prosthetic care, patient care facilities are not considered essential health benefits. So this is we are certain that as O&P providers, you are all essential, and that includes manufacturers of orthotic and prosthetic components. So we're really encouraged by the stories that we're hearing come out of O&P right now. Practitioners that are going into COVID-19 patient rooms and fitting TLSOs, and practitioners that are going to patients' homes and delivering cranial helmets. Those are all really timely, needed services, and so it's really great that you all shared some of those stories with us. There are a few restrictions, and some states have additional guidance with respect to the requirements about limiting patient visits. Those are very few, and some of them are related to emergent and urgent care. But as you all know, a lot of the care you provide is urgent and emergent. So we just encouraged by hearing that you all are still open for our patients to get served. So I'm going to let Justin talk a little bit about the CARES Act.
Thanks, Ashlie. And so I know folks have been hearing a lot about this legislation. It passed a couple of weeks ago, and there is a follow-up to this today, coming today, and I'll talk about that in a minute. So there are actually, Congress has passed 3 bills specifically just dealing with the coronavirus. The first 2 were a little less related to what we're doing. The third one, however, which was the CARES Act, has considerably more oomph for our purposes. So The main, two of the main things that are coming out of that are, of course, I'll talk about the stimulus payments first. 30 billion in stimulus payments directly to fee-for-service entities. If you were entitled to one of those, you should have gotten it by now. I was actually just told today that the last of those had gone out. There was an additional 70 billion forthcoming, and I'll kind of get into what's going to be in that a little later in the presentation. 20 billion of that is kind of an extension of the 30 billion. So when you break down this 100 billion in stimulus payments that are in there, 50 billion is going directly to providers. The other huge component of this, of course, is the Small Business Administration loans, the Paycheck Protection Program. The first bill, as I think folks know, which again was passed a couple of weeks ago, had 349 billion in it. That has all since been used up. They went through that very, very quickly after some initial rollout issues. The statistic I keep quoting is that the Small Business Administration in all of 2019 for the entire year did $58 billion worth of loans. And so now the same administration with the same staff was tasked with doing $349 billion in about 2 weeks. And so you can imagine there were some problems getting that out. I know some folks are still waiting on that money. I think most folks are still waiting on that money. But if your application was in that pipeline, if you got in from the jump, you should have heard where your application is. You shouldn't be hearing that there's no more money. But that said, even if you did hear that, literally as we speak together, Congress, specifically the House, is working on an extension to that. We anticipate that there'll be 321 billion more in loans, and I put loans in air quotes because if you meet the right parameters, and we'll talk about that, it does not need to be paid back. In fact, the federal government, for the most part, doesn't expect this money to be paid back. Also in the bill that they're passing today is 75 billion for healthcare providers. It's a little unclear as to what that's going to look like. I'll talk a little bit about what the language says later in the presentation. However, as is the case with the first bill and as is the case with this bill, Congress is very much leaving it up to HHS and CMS how this money gets distributed, who is selected to get it. There's a lot of leeway, and even CMS has not been terribly specific in terms of who gets it and why. For example, the 30 billion in stimulus, went to a lot of our providers. It took some more time than others to get it. But of course, the major question is, what can I use it for? And really, anything that you would be doing to keep your business open, to keep your doors open, to keep your employees paid is applicable, and they won't expect that money to be paid back. And then also in that third CARES Act, we got some language around veterans and specifically veterans' choice of where they get their care throughout the pandemic. And I've got some specifics on that coming up in a minute. So Ashley, if you wouldn't mind scooching to the next slide. So talking more about these the first round of 30 billion. So again, that last, there's two versions of the CARES Act. There's the one that passed a couple weeks ago, and then there was the one that they're doing today. The one they did a couple weeks ago, again, 30 billion directly sent to fee-for-service providers. As I understand it, as we understand it, all of that money has been distributed. There is nobody left who should be waiting on any of that funds. You can check your status via the 1-800 or 866 number you see on your screen. That's an easy way. I've called that a few times, either just to get information on the program or to help one of our members figure out their status, and I have not found any issues with the folks on that number not knowing what they're talking about or giving bad information. It's actually been a great tool to have. A lot of folks have asked, okay, do I have to sign? There's an attestation form that you're supposed to sign to accept the money. One of the reasons our PowerPoint kept changing is because the rules on that kept changing. Originally, they said, you had to sign this attestation form maybe even before you got the money. Then it was, well, you've got the money now, but you have to sign the attestation form or we're going to figure out how to get it back. And now it's basically like, sign the attestation form, agree to the terms, and I will emphasize that we have found nothing in those terms that we couldn't abide by. There's nothing in there that's crazy. There's nothing in there that is any different than what you would have as a regular Medicare fee-for-service provider. There's no outlandish rules. But even if you don't sign the attestation, it's taken as a sign that you agree to the terms, and so you don't have to sign it. So it's a good tool. That website that's on your screen, the hhs.gov/provider relief. It's a good tool to check the status and where you are and just get some updates on your own kind of accounting on this. But in fact, you don't have to sign that attestation form. It's considered as an acceptance of the terms if you do not sign it. Again, there's there was $100 billion for this program in the provider relief program. So again, that $30 billion has already been sent out. There is another $20 billion that is set to go to folks who may not have gotten it yet. There's $10 billion that's going to be allocated for targeted distribution to hospitals in problem areas, and that's going to be on a proportional basis. So hospitals in New York, for example, are going to get a lot more than hospitals in South Dakota or some of these areas that haven't been hit so bad. A lot of that remaining $100 billion will go to various healthcare entities to treat the uninsured. There's obviously a lot of uninsured people getting treated now, and the government wants to make sure that they're kept solvent, so there'll be money going to hospitals and healthcare facilities that are treating large populations of uninsured. And then $10 billion will go to rural healthcare clinics and hospitals. Again, there's because this is the bill that's coming out because this distribution is being made kind of now. They wanted to send that first $30 billion out the door as fast as they could. They kind of held back on this on the $70 billion just to kind of cross the T's and dot the I's. So it's still a little unclear how specifically it's going to be distributed, but that's the guidance that they've given, is that's where the remaining money is going to go. So there may still be yet more money for our members and for our profession, but it is not clear. I would assume that probably not a lot of it will go out to our members. I feel like we've already got it, and they're making very, very sure that nobody is double dipping or getting more than they would normally get for any of this.
And just
sorry, go
Justin,
ahead.
no, it's okay. I just wanted to add that through the OMP Alliance, AOPA did make suggestions about where the additional funds should go, acknowledging areas that might not have been fully taken care of in that first $30 billion. So Justin had shared that they're looking at rural areas and providers and communities that are disparate or in low income areas and things like that. So we may see some, but we're not sure that we will even get the guidance on that, because we didn't receive any notification that that first $30 billion was coming. So we did make, I think, a strong argument for why OMP should receive some of those funds, but like Justin said, hard to know if we will actually see that.
Yes, that's right. And so one other thing that we included in that bill that we wanted to be sure of was that, we've had an issue somewhat with, a patient not being able to get the care that they, so they've been seeing the same provider for years. Sometimes if they're a veteran, the VA will come and tell them, well, you're better off getting that care with us, or kind of not giving the vet the choice, even though that is by law what the veteran should be allowed to do. And so we knew that this pandemic was going to cause all kinds of chaos to the continuum of care, not just for veterans, for everyone, but targeting the veterans specifically. We were approached by a couple of members of the Senate saying, do we want to codify that the veterans should have their choice of provider throughout this pandemic? And of course we said yes. So the language that you see on the screen was actually in the last CARES Act, making sure that they get it from whichever entity they want. In addition to this language, we've also reached out to the VA to try to ensure, if the VA, for example, is not open, that the veteran can still continue care, that there are no delays in care. We have heard from some VAs, and this is, on a hit and miss basis, that they won't fit recent amputees for prosthetics, for example, during this crisis. So we're trying to formulate, we're working closely with the VA and the folks who need to be working at the VA to kind of formulate national guidelines. Like, if the VA is in fact going to be closed for health reasons, and of course there are legitimate health reasons for a VA to be closed, we just need to make sure that the veteran is still getting their care from a community provider for somebody, that they have the right to do that. And so this is, it's an ongoing conversation. We're obviously in the midst of this pandemic. There's a lot of, things change on a daily basis. So you don't want to say that, the VA is restricting care or things like that, because I don't think in fact, I know they're not intentionally trying to mess with healthcare of our veterans. It's just sometimes if a clinic closes, we need to make sure that the doors are open to the kind of care we provide. So working closely with the VA to make sure that these vets have the ability to get the care that they need, even in the midst of all this, has been hugely important to us. So including that language was a big part of that. And I think, yeah, so go back to Ashlie.
Yeah, I can talk a little bit about the Accelerated Advance Payment Program. So this is a program that's been around for years, and eligible providers can request up to 3 months of expected Medicare payments in advance, and that's made if their business operations have been impacted by COVID-19. And there are some restrictions, so the providers must have billed Medicare within the last 180 days. You cannot be in bankruptcy, you cannot be under active medical review, and you cannot have any delinquent Medicare overpayments. So there's some stipulations around these funds, but this really is an opportunity to say, okay, I know once everything's back up and running, I'm going to be seeing this portion of Medicare patients, and you can request for those advance payments to be made. And again, this is not a program that was created in response to COVID-19. It's just being utilized in addition to the previous application of the program. Oh, another one for me. Yes. So great news for some. I know that many may have already had the opportunity to work in new practices and preparation for prior authorization implementation for Medicare, but that has been paused. And for years, I think many of us that worked in O&P facilities, I know at my facility, we had to submit for pre-certification or pre-authorization to commercial payers. And so some of you may have been ready for this, but what we recognized was there was likely going to be some problems getting this up and running, on both sides, not just in O&P facilities, but also for the program to actually get up and running with the contractors. And so we were happy to see that this has been delayed, and by pause, they have not given us a date. So they continue to do their educational webinars. You may have seen that CGS is doing some of those webinars. They're staying on schedule with those, but we are in constant communication with CMS, and they will inform us as soon as they have next steps or as soon as they have a new implementation date. So we will make sure to let you know. Another one, suspension of audit activity. Obviously, it would be really hard if you have a reduced staff in your facility right now to respond to audit requests. And so finding out that audit activity was suspended was a breath of relief for a lot of people. We had some questions early on about the degree to which suspension applied, and what we found out is that almost all audit activity has been suspended. So that includes RAC audits, target TPE audits. This is RAC audits, supplemental Medicare review audits, and also the performance recovery. The RAC contractor suspended the issuance of new additional documentation requests and complex medical review audits. So reasonable useful lifetime audits have been suspended. CERT audits or reviews under the comprehensive error rate testing program have been suspended. So the only caveat here to remember is that if there is suspicion of fraud and abuse, that they can still audit any activity, and that they can go back and look if they have concerns about any of your billing and claims submissions during this time. They can go back and review. So it's important to remember that this doesn't mean that you're not subject to audits. It just means that this audit activity currently is suspended. And that is a great segue into the fact that we are operating with some emergency-based waivers. Many of these waivers apply to physicians and other healthcare providers outside of the allied healthcare realm. And so when we talk about these, it's important to know that these are applicable for the entities that are currently operating under these circumstances. So for the relaxation of existing requirements for telehealth visits are applicable to those entities that can currently bill for telehealth. And that way, those waivers matter because under those relaxations, you may be receiving documentation that was created by a physician during a telehealth visit. And it's really important that we know that that documentation is going to be acceptable for purposes of medical necessity. So we have actually made that specific request to the DME Max for clarification to ensure that any documentation that's provided to you by a physician that was created during a telehealth visit will be eligible as part of the medical record for corroboration, in addition to your own notes for purposes of medical necessity. I know that you all are trying to move patients along in the healthcare process, and it's probably harder now than ever to get that documentation. I see that we also put the relaxation of the referring practitioner documentation requirements for replacement orthosis and prostheses. This is great because obviously the waivers apply to this health emergency specifically. If you have a patient, for instance, that loses a prosthesis in transit on their way to the hospital, or if something is damaged as a result of the emergency, it's important to document that. There is a CR modifier that you should put on the claim. Unfortunately, this waiver is hyper-specific, and we asked this question during one of our sessions with the DME Max, and they clarified that this 1135 waiver must be as a result of the emergency. And this is retroactive. So if something has happened to your patient and you learn about that, that's related to this COVID-19 crisis, it is retroactive to March 1st. Okay, so we have another poll question here. This question, I'm gonna ask Justin to put it up, but it's, are you using telehealth in your practice?
I'm just going to say that I'm going to put polls in every presentation I get from now on because this is pretty cool.
It's great, right? We've never used it. I don't know why we've never used it before, but yeah, it's a really, really cool tool. Can you, I can't see the side that you can see, Justin, so if you could let us know what it looks like with timing.
Yeah, so we're at about 30 seconds. I'm going to give people about 10 more seconds to answer. And then I'll put it up on the screen. All right. Good enough. It looks like folks who are going to weigh in are going to weigh in, and there we go.
Oh, this is great. It's great.
Yeah, no, this is fantastic. This is good information.
This is
we
really
have a lot, having a lot of conversations at AOPA about telehealth and the ways that our practitioners can utilize it. So that was very helpful. I appreciate that.
Yeah, and the Academy held a webinar on telehealth this week as well, which I attended and had a lot of interesting information. I think what's even more important is that we remember this moment, right, and that we take and learn from this. I think there is a lot that happens during crisis, and we're learning a lot every day now. So we hope to be able to provide additional guidance around the telehealth information, and we have heard your request about providing you all additional guidance. So we are looking into that now. This is just more information on the additional waivers that are out right now. So there is a temporary waiving signature for proof of delivery. If you can't get a signature because due to COVID-19, if a patient doesn't want to sign any paperwork, or they're nervous about that maybe they were sick and they don't want to get anyone else sick. There are lots of reasons. We were careful to read closely, and Joe McTurnan at our office dug into this a bit to make sure that that we were advising appropriately. But as long as you note that that you've noted in medical record that you weren't able to obtain the signature, this waiver is applicable for your deliveries as well. And CMS announced the relaxations of accreditation requirements. We actually we stood behind our credentialing agencies, ABC and BOC, in their concern about this. The suspension of accreditation requirements really does open up the Medicare program to increase fraud and abuse. And we've been battling that as a profession so much over the past few years that we felt like this was an opportunity for bad actors to be able to take advantage of elderly patients, as they have already in the past. So we wrote a strong letter through the OMP Alliance and submitted that, and we are supportive of ABC and BOC's position with respect to the accreditation requirements. And CMS has also indicated increased flexibility in the processing of appeals by both fee-for-service and managed Medicare contractors. We have asked for additional clarification on what that looks like, what that flexibility, how that flexibility will be used. So we're always waiting to hear back. I think we probably submit questions once or twice a week to CMS and the DME Max, and we will write those up and provide that additional information to you all as it's given to us. So things you should be doing now. Back to Justin.
Yeah, so a little more details on the Paycheck Protection Loans. Again, $349 billion was in the first CARES Act, or CARES Act Part 1. That money has since been used up, and again, as we speak, the House is voting to finalize another $321 billion for the PPP. That should be voted on today, probably signed by the president today, and that means that money will probably be in the hands of these the 7A lenders, if not this weekend, then early next week. Congress, this one took a little bit longer than I think they would have liked. Congress put in language to ensure that $60 billion of that $321 billion will go through banks that don't normally do SBA loans, offering up the opportunity for businesses that and banks that serve rural and underserved areas to have a little better access to that money. So there was some back and forth on how that would look, and so it's all been worked out, and so $60 billion of this will go to rural and underserved areas. That said, you know, the last round of funding was gone in about 2 weeks. This money, because there's now so much awareness of this program and demand for the money, is expected to be gone within about 48 hours. It's going to go very fast once it's out. Originally, the banks didn't really have the mechanisms to disperse the money. They had to kind of draw those up and create all this. In conjunction with the SBA, those are all in place. So this money is expected to go very quickly. So if you have not gotten a PPP loan and you would like one, make sure that well, you can reach out to me. You can follow you know, any news website to know when this language is finalized. But by all means, reach out to me and for advice, and we can help with that. I've gotten the question very often: can I get a PPP loan even if I've gotten that grant from HHS, part of that $30 billion? You know, that just showed up in my bank account. Am I still allowed to get a PPP loan? And the answer is absolutely. Both of those things are designed to help you keep your doors open, and so by all means, do both. In fact, it's encouraged. Anything that you can do to keep your doors open and keep from laying off staff is encouraged with all of this funding. So I know there will probably be questions about the PPP loan, so I'll leave it there, and I'll wait for questions, and we can move on with the slides.
It's a poll question.
Yay, and this is going to be my favorite. So just curious as how many folks on the call have utilized any of these. I mean, utilized is a rough term when you talk about the HHS stimulus because you just got the money. But very curious as to how many folks on the call have gotten these. So I'm going to launch this right now and give it about 30 or 45 seconds for folks to answer.
And Justin, I think you're right about there are probably going to be some questions. So you might want to point people to the webinar that we did on PPP and the guidance that was provided by our lobbying firm.
Absolutely. So there are a couple of webinars on the, well, there's many webinars on the AOPA website, but we have one specifically dealing with the PPP program and what it is, what the rules and parameters are, and then that was the first section, and then there's a whole other section on how to access the money. So that webinar is on our resources page that Ashlie pointed out earlier, so please do check that out. Again, any questions can be directed my way as well or asked on this webinar. So this has gone on for a while. I'm going to close it down and share the results. It looks like most people have gotten more than one of the above. I would assume. But that's great. That's great. It's good to know this has been working for everyone. So that is good to hear. And
Really
I
good.
think kicking it back to Ashlie for the next part, I think. Oh, no, I'll do this. So again, please reach out to me. That's my email address. Any issues that you're having accessing either the provider relief or the PPP loans, please do reach out and I will do what I can do. The other thing, as Ashlie noted at the top of this, we are really emphasizing to Congress how our work cannot stop as a result of all of this and the work that we're doing. You know, I'll talk about this in a minute, but you know, we're viewed by a lot of members of Congress as suppliers of DME, and we're so much more than that. So if you have stories, pictures of your folks doing the work that you do in the midst of all this, please do send them my way because they're very, very good to share with folks on the Hill. I can't go physically to share it with folks on the Hill. I'll be emailing it. I don't know when I'll get back to the Hill, but please do share that. And if you work at all with any veterans, please let us know of anything that might be impacting their access to care as well, because again, with the ongoing concerns we have with providing health to our veterans, we want to be made aware of that. So any of that would be greatly, greatly appreciated.
Yeah, you can obviously send those stories and the any information about the VA to Justin. We also have a section on the co-op here, and we're doing a poll there on the VA page. So this is the VA page. We've provided that information that was in the CARES Act that we shared earlier here on the VA page. We also provided some information that we received from Jason Highsmith, who's the National Program Director for Orthotic, Prosthetic, and Pedorthic Clinical Services. This is what he shared with us about local VA facilities having, you know, the right to do certain, close their clinics and things like that. So we wanted to share that with you as well. But we put a poll here and we're trying to collect as much data as we can from you all on the co-op. So please share if you can. All right. Justin.
Yeah, so I think a lot of people, I hope folks are aware of legislation that AOPA has been championing for years in a couple of different incarnations. And one of the main things that our legislation would do is separate O&P from DME. Obviously, and especially we've gone over this in this webinar, we are not just suppliers of medical devices. We do so much more than that. We're in the hospitals, as Ashlie said. We're in people's houses working with kids on their cranial helmets. But there's this perception that the supply aspects of DME are the same as the clinical care that we provide as O&P practitioners, and it's just not true. So we had a bill introduced in this Congress in the House, HR 5262, the Medicare Patient-Centered Orthotics and Medicare Patient-Centered Orthotics and Prosthetics Care Act, Patient-Centered Care Act. Sorry. And so we're taking part of that bill. We're trying to take part of that bill, not all of that bill, and move it into whatever the next COVID bill is. So today, as I said, they're finalizing another funding bill to kind of ramp up the PPP again. Then Congress is going to take a couple of weeks off because obviously it's dangerous to be in DC. It's weird what's going on in the Capitol right now. They're basically voting in alphabetical order, and there's only 20 or so people in the chamber at the same time. So voting is taking forever because they bring 20 in and then they all go back to their offices and they bring 20 in. So legislating in the midst of this is difficult. So they're taking another couple of weeks off. Then they're going to come back and work on another, not necessarily bill that deals with the financial aspects of this, but that deal with the real life aspects of this. And because we see this as an opportunity to separate ourselves from DME, just showing the work that we've been doing. And that allows us to just, you know, it's the first domino to fall in a larger plan to just create greater awareness of what it is that we do and have more leverage on the Hill and with CMS with that separation. So that is, as the AOPA lobbyist, that's what I'm working on to try to get that part into the next bill and get the rest of the bill passed as well. I'm going to skip to the last bullet on this page and encourage you to join our virtual policy forum, which is May 6th from 1 to 2:30 or so. I say that because there's many more aspects to that bill that I'm not going to go into on this webinar, but I would love you to hear about. So please do join us for that, because I would love to have you on our virtual policy forum and more involved in what we're doing with advocacy. Then I'll do the third bullet. We're bouncing around. Again, there's $75 billion in this bill today that we're not really quite sure what it's going to do. It just says to healthcare providers, and trying to reach spots that have not been included previously. But obviously, a lot of that additional PPP money is targeted at that as well. So trying to figure out if there's a way for some of our providers to get that $75 billion as well. Is something that we're going to be doing. So you'll be hearing more about that as well. And then for the last bullet, I will go back to Ashlie.
Yeah. So we have sent a letter to SEMA Verma suggesting that the agency consider settling ALJ cases. So for those of you that are clinicians that have cases that are in the backlog of ALJ right now, we feel like even a decent settlement offer might help free up some cash for O&P facilities to be able to survive this. And recognizing that we, especially in prosthetics, have an overturn rate that's really high. So if you make it to the ALJ level with a prosthetic patient, prosthetic claim, a lot of times providing the information and background, we're having those overturned. So we felt like this would be a really good opportunity just to make the suggestion. And there is an argument there, because we are different than a lot of the DME cases that are in the backlog as well. And so we're hopeful, and in that communication with Administrator Verma and her office, we feel like this is kind of just an opportunity to be collaborative and think of ways that CMS can be helping O&P providers right now. So that's where we're at with that. Of course, we will let everyone know if we hear back about that. Obviously, AOPA as an entity can't negotiate a settlement. That's not what we don't have the ability to do that. We don't have claims that are in the queue, but it does, I think, help when we are articulating these needs and possible ways to provide relief.
Excellent.
Yeah. So I guess we can
open it up to questions.
Yeah.
All right, thanks so much, Justin and Ashlie. That was very informative. We appreciate it. One thing before we go into the questions, just kind of a housekeeping thing, you do need to complete a 10-question and pass with 80% of 10-question quiz. When we close this meeting, it will pop up in another tab in your browser, depending on how your browser is set up. If it does not pop up, do not panic. We will also send a link to that in the follow-up email about an hour after we're done. So just keep that in mind. To get your CEUs, we do need you to pass that quiz for us.
I'm pretty sure I can pass the quiz.
All right, if Justin can do it, any of y'all can do it.
Yeah, that's true. That's true.
Okay, so if you guys have any questions, on the right, you will see there's a question tab, and you can go ahead and type in whatever questions you have, and it will pop up to us. The first one we have here is, I have a MAC level case that is pending a ruling and has been in the backlog for 6 years. Could there be some acceleration at this level, like you suggest, at the ALJ level?
Yeah, so that's actually the bullet point I just covered. I'm going to assume that question was asked before we got to that bullet. There is a good chance. I mean, we feel confident that if O&P entities feel like they want to go to CMS and ask for a settlement right now as an individual entity, it really benefits CMS to have a lot of O&P facilities accept that settlement. And so there are some efforts, some more organized efforts around looking at possibilities of negotiating settlements. But as I said before, AOPA as an organization, we can't do that on your behalf because it requires kind of digging into your files and working with your legal counsel and things like that. So we felt like by pushing CMS to recognize that there is a backlog and making a collaborative sort of opportunistic, it goes both ways, offer that that would be received positively by CMS. So we're hopeful. And if they come back and say, yeah, we definitely want to settle, bring your players to the table, of course, we are going to put a wide call out to the profession. If you've got something in the backlog, please let us know so we can get this ball rolling.
Okay, great. Thanks, Ashlie. Can you please tell us more about the virtual policy forum on May the 6th?
Sure. So, we have what in DC parlance is called a fly-in every year, where we bring in members and patients to go up to the Hill to talk about our advocacy efforts and the legislation that we're working on. Obviously, we can't do that this year. So we have converted it to an online version of this event that we normally have. So you'll get some advocacy training in terms of how Congress works and how things on the Hill work, and how COVID has disrupted that and how we're dealing with this new normal. We'll talk a lot about some of the issues we've discussed on this webinar in terms of keeping businesses afloat and work that we've been able to secure for PPP and things like that, just kind of letting Congress know about the issues that we as O&P practitioners face. We'll talk about the bill that I mentioned, the Patient-Centered Care Act. There are other aspects of that bill that are very important to our profession that we want to get passed. So we'll be talking about the avenues to that and things that we can do. We'll be talking about another bill that we work on called the Wounded Warrior Workforce Enhancement Act, which would, in a very, very small thumbnail, would move money to the Department of Veterans Affairs. It's a long story. As it's written now, it would move money to the Department of Veterans Affairs, which would then partner with their local O&P schools to kind of build their student base, to provide more, to create a bigger workforce, to get more students, to build more workforce. And I say it is the VA now, but we're actually moving that bill out of the VA and through the DoD, because we're going to have a little bit of a better avenue to get the bill passed if we work with the DoD instead of the VA. So you'll hear much more about that during the virtual policy forum. There'll be an opportunity at the end of it to reach out to your members of Congress. We'll have phone links available and emails available where you can write your members of Congress and let your voice get heard. And I don't want to jinx myself, but I'm 90% sure we'll be joined at some point during the virtual policy forum by Senator Tammy Duckworth, who will talk about some of the work she's doing on the Hill. For those who don't know, Senator Duckworth is the only amputee who serves in the Senate. So we will be thrilled to have her, but would love to have everybody on this call join and become advocates for AOPA. And reach out personally with any more questions as well.
Yeah, if you haven't been to a policy forum before, it's unfortunate that we won't be having one. It's one of my favorite events that we do as an organization, and was one of my favorite events to attend prior to joining staff at AOPA when I was running an O&P business. So I feel like it is a great opportunity to learn about how to have your voice heard in Congress, and Justin does a really great job. So please consider joining.
That sounds really great, guys. Thank you. That sounds exciting. We as a profession need some Vegas time after all this disruption. Is the AOPA National Assembly still scheduled as planned?
We talk about this every day.
I hope so. I need to get out of the house.
I mean, they're reopening Vegas, today? So as of today, yes. I mean, we literally, I'm not kidding when I say we talk about this every single day. So as of today, yes, it is still happening. Obviously, we will let folks know as soon as things change, but as of today, we do plan to put on a show.
And we're working really hard to make sure that it's going to be, you know, the best show we've ever had. I mean, we're being innovative with the ideas that we have for sessions. You know, our assembly committee is working hard to go through all of the abstracts that were submitted and make sure that it's the strongest, you know, possible curriculum. So we're working as if we're making it the best show we've ever had, and so we hope that it'll still be on.
All right, perfect. We hope so too. We want to see you guys there for sure. Are there specific banks to go through for the SBA loan or non-refundable funding?
Yeah, so I mean, they have to be, your bank has to be authorized by the SBA to be able to distribute those loans. All of that information can be found on the SBA website. They have a very targeted site for this program and the PPP. So check on there in terms of who your local banks are that would be the providers of that money. You can't just go to any bank, in other words.
And we have heard that it is easier to get one of these loans if you're working with a bank that you have a record with. So
Right.
if you have two banks and one, you know, even if one staff is more responsive than the other, you know, think about those kinds of things when you're thinking about working with which bank you're going to get this loan from.
And you said that's what, sba.gov or something like that?
Yes, it's just SBA.
We have a link on our website to that site as well under our COVID-19 resources.
Okay, perfect. That seems to be all that came through right now.
Those were easy. Did I pass the quiz?
A+.
Great.
And then if you want to go, we added one last slide here to the end for next week.
Yes.
If we have some more pop through while I'm talking through this, then I will have you, we can address those as well. But next week for our Freedom Hour, same time, same place, it's going to be April 30th, 11 Pacific, is going to be a never a wasted moment, staying productive during a downturn. So we're going to have Leslie Sissons of O&P Insight and Jessica Norrell of MOZN Solutions. And they're going to have 5 categories of your O&P business and the important strategies that each one of these categories can do to use their time wisely during when you might have some downtime, you know, and in this unprecedented event that we're in, to be better prepared for your new normal when your patient care numbers resume. So you'll see those on our social media sites, and also if you go to Freedom Innovations and click the events tab, you will have the registration link there as well. So that looks like it for the questions. I don't see any more coming through. So tons of thanks to Ashlie and Justin. Thank you so much. It was incredibly informative. We really appreciate you guys coming out. A lot of great information there. And we look forward to your policy forum in Vegas.
Thank you. We do too.
Thanks so much for having us.
All right. Have a great weekend, guys.
Thanks.
Bye-bye.
Bye.